we always say come as you are, so don't feel like you have to come on off camera or on camera. But we'd love to see your faces if you are at a place where you can join us. We have such a special guest tonight. I'm going to let Shannon introduce her. And then I also just wanted to get started by letting you guys know that we've got some really fun things happening over here at Kick Cancer. I don't know if any of you guys have, oh, I should have worn my hat. I'll go get my hat. And maybe you have your hat. Oh, there we go. Okay. Okay, good. Shannon's got her hat handy. We have a campaign going right now for these amazing Pray Big. You can't really see it on Shannon, but um, it says Pray Big. So cute. 100% of the proceeds of these hats are going back to Kick Cancer, which is super exciting. So I'll put the link in here if any of you guys want to snag your hats. It comes in yellow, it comes in blue. We're making some in pink, and then the kids' hats come in white. So I will put the link in here if you guys want to grab that. And then super exciting news, we are finally planting roots. We've been all over the place, like all over the US. Some of us are in the Midwest, some East Coast, I'm in Phoenix, Seasons now in San Diego, but we are officially planting roots in San Diego. We are moving into Biodynamic Wellness, which is Seasons location. So if any of you guys are in the Southern California area, I know Lacey, you are, we are going to have a Kick Cancer grand opening at the Solana Beach location on June 5th. So if you guys find yourself in the area or if you're close by, we would love to have you guys join us. So we'll put some of that information in here too, and we'll be posting about it quite a bit. So just a couple little of announcements before we get started, but Shannon, I will let you and Christina take it away.
Oh, it's been such a pleasure getting to know Christina, and I just happened upon her in our Kick Cancer social media, and she had liked some of our posts, and I looked at her profile. I'm like, wait a minute, you're a pediatric oncology nurse and an NTP, and like having all this experience. But I am going to read this because I don't want to miss anything to introduce her. So Christina Moreira is a proud owner of Cheers to Health, a practice that teaches individuals and families about how to live a holistic, balanced lifestyle. Christina has almost 2 decades of experience in pediatric nursing and is a certified nutritional therapy practitioner. Majority of her career was caring for pediatric hematology oncology and pediatric bone marrow transplant patients. She's seen the lack of nutritional support for this patient population and is dedicated to learning more and bringing awareness for these kids and their families. Just to be on that floor and make that head change, right? Just to experience it, to see it, and then go, I need to go over here. I need to support them in a different way. She is a mom of 2 boys, and her oldest son is how her health journey started, looking into foods, household cleaners, personal care products. She learned all those items and more attribute to their overall health. She has also seen how important mental health is for our overall health and sees the negative effects it can have on the body. She has navigated through postpartum depression when her kids were young without antidepressants. It was a challenging time, but she came out stronger and learned a lot about herself. She is a big advocate for talking about emotions and what is going on in one's minds, which can in turn help individuals thrive in their health journey. So now she works with individuals to get to the root cause of issues that they have been dealing with. She does this through a very personalized approach, looking at nutrition, sleep, stress, lifestyle, and more. Her passion is working with kids and families to educate and empower them to take control of their family's health. Hello, Miss Christina. How are you doing today? Beautiful lady.
Hi, good evening, everybody, or good afternoon, depending where you are. Again, I am honestly just so honored to be with you all, these incredible moms and the Kid Cancer that are on the board, these families that I have personally walked alongside when I was at the bedside doing pediatric oncology and transplant. It is a lot that you all go through. It's a lot that these kids go through. And like Shannon said, with my mindset shifting to more holistic care, there's really so much we can do. And I think this is such a wonderful nonprofit that has been founded. All the information that they give, primarily peer, I use in my home, branch basics, just so many things that unfortunately are out of your control when your child has cancer, but we can control so much. So we will get started on our talk. So we're
Yes.
gonna,
Well, before we get started, we also,
yes,
like Christina also asked if we would open up in prayer. And
yes,
we absolutely, when we say pray big,
yes,
we're
amen.
actually doers. We're not just sayers. So
Yes, let's do that.
let's pray. Dear Heavenly Father, Lord, I thank you for our volunteers. I thank you for our board members, and I thank you for our speakers who are willing to come on here and pour into our cancer family members, Lord. We love them so much, and I know that you love them. They are your children, and they are your children's children. So we just ask that you bring a blessing, you bring healing upon these families, Lord, that you just speak to Christina, you allow her to speak the words that are going to comfort these families mentally and emotionally today, Lord. May all the stresses around us be subsided. May they chill, wait for another time, Lord. May we be at peace and able to listen to what is being said today. In Jesus' name. All right. So we have some questions lined up, but if you've never been to one of these calls, it's really open Q&A. So if you have a question, definitely type it in. Dana always tries to remind me like, hey, there's a question. If I don't see it, we can always read it at the end or wait till the end. We'll open it up. You can turn on your video and just be here face to face with Christina and open with your questions. So
Yes.
all is welcome. But we are going to be tackling emotional and mental wellness, not only for the child who is going through treatment, because we know that this affects the entire family. So we're also going to get on the topic of marriage, which probably could be its own Thrive talk, right? And siblings. But we're going to tap into all those a little bit and see what Christina has. So let's talk just in general, whole family. I know every family unit will do what works for them, right? And because it is bio individuals, bio family, your
Yeah.
family unit, what's going on there. But how can families maintain a sense of normalcy, routine while navigating these complexities of cancer treatment?
So it's really important to remember there may not be a sense of normalcy for a while. It's kind of like you're adapting to appointments, who's going to have to take off work, who's going to have to take a PTO day. Do we rotate it? Can I take FMLA leave? So really sitting down and being mentally prepared for busy, long appointments will help. Because if we mentally prepare ourselves, like, okay, I have to wake up at 3 in the morning, I need to go to bed by about 8 o'clock. So planning ahead is really going to be crucial and not setting the bar of too high of expectations because the minds of you in your home is already so busy with so much stuff. Who's going to cook? Who's going to clean? Who's going to do laundry? So if you guys have a planner, I'm a big advocate for a planner. And there's a lot of apps that have family planners and you can color code each family member. So blue is your husband, pink is the child that has an appointment, the other child has sports on this day. And then also depending on the age of your children, sitting down together and saying, okay, this is what this week's going to look like. So and so, Grandma Rose is going to pick you up from school today because this is what's happening. And a lot of times with kids, being honest with them is best policy. Never I never liked to lie to my patients because kids need that safety net. They need to know that they can trust you and that they're going to be okay because that child that is diagnosed, they're going to have their labs drawn. They're going to have a port. Now they have to have their needle changed every 7 days. Did the EMLA cream work? Did it not work? And then now they're traumatized. They have to hold them. And there's just so many factors that go into that. So just being honest with them, again, is very important. Kids know. kids are very intuitive. So they feed off of the family's energy. So again, just sitting down and again saying, okay, this is going to be our schedule. And once you kind of you'll get in your own routine depending on what is going on with your child at that time. And again, setting expectations for the day. Maybe the appointment got canceled, and mentally being prepared that we're going to have to be very flexible as well. So if there's some parents that, some moms too, where some can be very type A, okay, it has to go this way. And that can cause anxiety. You're going to have anxiety because you're so nervous dealing with everything. Am I smart enough to know what these doctors are saying? So just giving yourself a lot of grace. Nobody is expecting you guys to know everything, to handle everything. That's just, again, not realistic there. And again, like I said, sitting down as a family or as a couple to discuss the week will, again, just make sure everybody is on the same page for that.
So obviously plan, but be
Mhm.
flexible because there's always a fever around the corner.
Yes.
All your plans are out the door.
Right.
I remember, like, I've always been pretty organized, but this required another level of organization. And I remember our oncologist coming in and looking at my planner and my 2-inch notebook, and she's like, "Wow, I am really impressed." She goes, "Some parents in here have no idea what's going on."
Yeah.
And it's a thing. Like, some of it is absolutely, you just have to have grace for yourself because sometimes it's too much to manage. It
It
is.
is.
And if that's not you, if you're not the planner, if you can't handle that, maybe it's assigning someone else in your family to do it.
Yeah, because like you said, fevers come in 2 in the morning. So you have to pack a bag, be like, all right, I gotta run, a husband, figure out what you're gonna do with school or getting the kids wherever they need to go. And I like that you did mention that you had a binder. So what I have seen a lot too is not and educating and empowering yourselves as parents, right? I have kids. I need to know what exactly is going on with my child. What are you going to give them? What are the side effects? So the more you know, the less anxiety you'll likely have by reading, by asking questions. Because oftentimes, if you go inside and you're like, oh, I forgot to ask him. So, being prepared, like Shannon said, I think really is going to help mentally to and emotionally give you that peace because you're going to know what to expect and you're going to know the questions to ask or you're going to know the answers to those questions already. So, I think that's a really good point that you brought up there.
Yeah. Is there any strategies that you think families can employ to manage their stress and emotional toll during the cancer journey?
So, going outside is very underrated. It's free. You don't need a membership. Even just going outside and grounding, which basically means taking off your socks and just connecting with the earth is so relaxing and peaceful. Even if you go outside and if, you're having a bad day, you guys got into an argument, kind of just simmer down, take 5 deep breaths. Again, deep breathing too. It's something so simple and so basic that you can do it anywhere in your car. If you see your child's getting, a bit agitated or the sibling, go outside for a walk. If you have a pet, take them outside. The sun, again, just gives a lot of energy. It's so relaxing. It can help to refocus your thoughts. Cry if you must. Release those emotions. It's very important to not store those emotions in our bodies because what happens is emotions get stored in organs in our bodies. So anger can weaken our liver. And I give people example all the time. What happens when you get the worst news of your life? Like when your child got diagnosed, could you breathe? Probably not. So grief is in your lungs as well. Worry is in your stomach. Just like when you get an initial diagnosis, you can't eat, your body can't think, so your digestive system is shutting down. So being mindful that taking a holistic approach to yourself as the mom, as a dad, as a sibling, will overall help you thrive in this journey that you're on. Um, Also, don't feel pressured by anybody. Everybody grieves in a different way, everybody processes emotions in a different way. So there is no right or wrong way to handle things. And that again goes back to how somebody was raised when they were younger. Um, so that's very individual, and we have to respect that. So let's say maybe, oh, I have my husband hasn't cried. What's wrong with him? Maybe he just doesn't want to talk about it, but say, hey, like, are you okay? Let's just talk. It doesn't mean that he has no feelings. It's men process things a lot differently than women do. Men are just very kind of shutting it in, but again, that's not, we want them to express their feelings because as a wife, you want to like be on the same page as your spouse and to know that you're walking together. And sometimes you may not want to talk. Sometimes your child may not want to talk, or that brother or sister may not want to talk. They just want to be held. Let them cry and hold them, maybe cry with them. And as parents, we want to show our kids that, nothing bad is going to happen, but that's not life. We can't protect them from everything. So showing our kids our vulnerability, and that it hurts us and it pains us, and that shows our kids like, hey, my mom is crushed too, like I am. I had no idea. She just looks so brave all the time. But if they see that vulnerable side of you as a mom, as a dad, as an uncle, whatever you are in this call, related to the oncology patient, they'll be that much more open to opening up to you as well.
Yeah. Oh, I love that. What you just said at the end kind of encapsulated what I was going to say about that. And I don't think I allowed myself to cry in front of my daughter during treatment because
Mm.
of fear, right? That it would influence her. Because at 3 years old, we tried to make it like the hospital was like Disneyland. Every day was
Yeah.
about her, right? We tried to
Yeah.
make it the funnest place on earth with, some really scary things around the corner, but over here it's joy,
Yeah.
painting, it's everything. But
Child life is there.
yes, child life. Hi, I'm here. Um, so I do wish that I had expressed a little bit more vulnerability for her to understand just my emotions and so forth. I love that you brought up sunlight because there was a documentary that I had watched. It might have just been a short video. I don't think it was a documentary, but a short video about sunlight and patients, where back in the day when the doctors didn't really have anything else that they could do, or the patient wasn't making a turnaround, that if they couldn't open up a window and shine it on them, they would roll their beds literally outside because sun used to be considered part of medicine. But
Right.
how often are we told that in the hospital now? And
Rarely.
never.
We had to fight like tooth and nails, if we had a bone marrow kid that was in for like a really long time and they were finally, saline locks. Oh, can we just take him outside for like a few minutes, you know, once they were, plus whatever day, but it's hard. It's
Yeah.
it's not easy, but if you're home, it's just like this rush of endorphins you feel outside, or just putting on essential oils. I love essential oils. Essential oils like Young Living, doTERRA, Revive, even some of those blends, you can put them on, diffuse in your home. So that's another really good modality. And if you're a Christian, whatever your faith is, just stop and pray, put on some worship music, and just be honest to God and just cry to Him and say, I can't. I need you to help me. That vulnerability is important.
Yeah. Yeah, I wish that someone had told me, like, when initially diagnosed, just sit down all together as a family and discuss, like, put
Yeah.
together a plan of actions, discuss your feelings, discuss your fears, do all that as a family. But it's not too late. Like, even if you're mid-treatment or towards the end of treatment right now, having open discussions with this is a healthy way of just, even if there's nothing you can do, allowing your kid to express their fears
Yeah,
is
absolutely.
huge for you to just hear them out. Hear
Yes.
them out.
Right. Because they're the ones going through it. They feel all the side effects. They have all the GVHD, sloughing, they're vomiting, the diarrhea, they have the rash, if they have GVHD to the lungs. I mean, they feel everything. So they know. So having them being able to communicate like, oh, this isn't working for me. Let's try this. They have to have a say in their care, obviously to a certain extent. It's again the age of the child. But like Shannon said, the initial diagnosis, it's a lot, especially if you're admitted. And I've seen white counts of like 80,000. They're super high. We have to do this. Or if you're going to an office, like she said, sometimes you just have to stop and breathe. If you're at an office, it's like, well, if you think about it, the cancer has been there for God knows months already, and say, hey, is this emergent? Do we need to be admitted right now? Or can we please have a day or two just to process everything? Because it's making quick decisions. It's,
Yeah.
you may be making the best decision, and you want to be informed in what's going on with your kid. And your voice as a parent is kind of taken away because now it's relying on the medical team to make those decisions for you. So I'm also a big proponent of using your voice as a parent. Don't lose your voice to the medical team. Instead, partner with your medical team to do what's best for your child. Because at the end of the day, you know your child best. They know oncology. They're very intelligent, but you know your child best. Your child knows their body. And please don't be intimidated by doctors. They are providing a service for you in a sense. They are caring for your child. So you want to make sure that you trust them and that you're able to ask questions. And that's what they're there for. That's, you know, I want you guys to really understand that, because even when I worked med surge, pediatric med surge, the parents were like, oh, we'll just do what they say. Well, what if they miss something? Physicians are human. Mistakes can happen. It has happened. So just be on top. How are the labs today? What were the trends? What antibiotic are they doing? What are the side effects? What's the chemotherapy? Is it going to cause any heart issues? Is it going to cause a change in their taste buds? Stuff like that. So that's again another important piece.
Yeah.
As well.
Well, we're going to be moving into the sibling side of it, and allowing them to express their emotions. And it definitely brings up, there was a huge moment for my eldest daughter, who's 2 years older than Paisley. So she was 5 at the time. And we were only a few weeks into treatment. And on our FaceTime, she had already expressed in tears, "You don't love me anymore. You chose Paisley." And so how can we support the emotional and mental well-being of siblings who may feel overlooked or struggle with feelings of jealousy or guilt?
That's very heavy, and they're still gonna have those feelings, aren't like gonna go away overnight. And obviously it depends on the age of the siblings, and to keep in mind their developmental needs. And like I said, we don't want to lie to the oncology patients, and we don't want to lie to the siblings. We want to be honest with them, but what your kids can, the type of information that your kids can handle and what's going to be too much for them. But also let them know, like let them know what's going to be too much for them and what they want to know. So that ways, again, they don't have control over, their play buddy, their best friend. They don't have control over when they're going to snuggle with you or with your husband or with a caretaker. So keeping their minds busy with sports, with friends, extracurricular activities, giving them a safe place or a safe person that you trust if you're not home. Because the initial times that's really long are the initial diagnosis, or if like there's an AML diagnosis, their counts do take a longer time to recover. Bone marrow transplant, we know, is quite lengthy. So even rotating with the spouses or a sister, some sort of family unit, So that way you're able to go home. Cause I did see a lot of like the mom always stayed. And I would think, well, how is she, managing with the child? I'm sure that sibling misses their mom.
Yeah.
Having FaceTimes, maybe the child is very sick and the mom can't leave. That happens. They're in PICU or God, something is just not going as it should. Having little date FaceTimes, even if you're able to get away just for a little bit, like 30 minutes, having like a little date time with that child is important to do. Allowing the
Yeah.
siblings to visit in the hospital if allowed, if permissible, if they're well, having them play together. Um, and like I said, paying attention to the siblings' schoolwork is important. If they're, let's say, middle school, high school, and their grades are starting to slip, if they're on their phone all the time, if they're hanging around the wrong crowd, you're like, this isn't my kid. Those type of children, those are might be like signs that they're looking for a void to be filled, or it is common for kids that have anxiety to cut themselves. So if they're starting to wear long sleeves, check their arms. As painful as that is as a parent to do, I've seen a lot of that. Make sure they're not ordering anything on Amazon. A lot of kids, teens will order, razor blades on Amazon and do what they want with it. Check their
Wow.
phones, check their social media, check everything to make sure they're not doing anything they're not supposed to do, and sit down and talk with them, especially if they're teens. Be like, listen, I know this sucks. It sucks for me, and I'm sure this sucks for you. So really being raw with those teens, and probably a little bit more sensitive with the verbiage for elementary kids. And also if they're in school, letting their teachers know what is going on so that teacher can be cognizant if there's any behaviors like, hey, she's acting weird, or this isn't like him to do something like this, what's going on. And if that's the case, maybe a school has a counselor, that child's made in an outlet to verbalize their feelings and what's going on in the home.
You tackled so many great points there. I think when we're talking about, making sure that the siblings are still able to keep up with their sports and stuff, like you literally have to find someone in that sport, like a sport mom that
Right.
can be your taxi driver. Be like, can
Mm-hmm.
you make sure that they get to and from their sport? Someone
Yeah.
that you trust, obviously.
Yeah, of course.
And we were, after Savannah had expressed that, we were able to do a date day with
Oh,
Savannah, but we really had to schedule it. So
yeah.
my husband, which we thought was the best thing, would stay with us for the 7 days in hospital. So we would snuggle on that one little cot
Yeah. Oh my God.
or be in bed with my daughter. The two of us are there. But because we had my entire family, like all, 25 family members, to make sure she was with cousins and having fun, but she still felt that, she was having fun, but she still felt you chose sister. So when we did the date day, two things: you could either have a nurse or child life, and you're like, I'm going to step out for 2 hours and I'm going to, take my daughter out to lunch, my other daughter, especially because ours happened initially during flu season. So
Okay.
sister wasn't able to come up there and visit, which
Yeah.
was a whole nother separation anxiety, right? She wasn't even able to see her. So that's always difficult. But another time we were able to get a family member to swap. So she would bring Savannah, we would switch. Family member would watch Paisley, we'd go out with Savannah. So
Yeah.
those are just options to be able to do. Okay.
Yeah. Talk about getting creative, and don't feel bad asking for help either. Like, hey, can you please help me out? I mean, that's really a mode of like way to survive and to way to get through this with your sanity, is reaching out, because we just can't, it's impossible to do all that alone. It really is.
Absolutely. And even just to that point, Christina, I think it's important because people want to help, they just don't know where to help. So
Exactly.
Even if you have that mindset of like, hey, I do need help, and this is where I specifically need help. I think that
Right.
people appreciate that sort of advice as well.
Yeah, you're 100% right. Give them a job and they will happily do it, no questions asked. Because like you said, they don't know what to do. So
Right.
if you tell them this is what I need to be done, they'll do it, no problem. Good, very good point.
Yeah. So this one I want to ask to those who are on the call, you can type in the chat first, and then I'm going to direct it back to Christina. But what are some ways that you involve siblings in the care process that didn't overwhelm them? Like, is there anything that you did in your family that was effective, made them feel special? I'm helping to do something that was weird for us. Weird as in I didn't think she would want to, or even Paisley would want her to. But when you're at home and you have to have those immune boosting shots, so we would have to give those daily, and Paisley would choose who she wants to involve.
Oh,
And sister was the one, and I'm like, oh, like you're 5. Do you want to, like, I don't know if this is a thing.
oh,
But Savannah was so tender and so sweet and like,
oh,
oh, Paisley, is that okay? And it was just
how cute.
like knowing like this is supposed to help her and boost her immune system and get it. So anyways, did anybody else do anything that allowed siblings to get involved that you felt was good for your family? Just throw that in the chat. And I'm going to throw that question over to Christina. What do you think are some effective ways to involve siblings?
I think that's a really good way because like kids love to play nurse, they love to play doctor. So I think that's a really cute idea there, or helping maybe get their pouring their juice for them if they need to take medicines, or maybe the family has decided to give to everybody for that patient to take vitamins. Maybe those vitamins will in turn help the overall health of that sibling. So they can maybe partake in the care of their child, like, oh, I'm gonna get, healthy too, like Paisley's going to, and maybe it can be like a whole family thing, you know. Um, and sometimes they make like cute little gowns for ports and stuff, so maybe they can pick out something together. Maybe, if the child is getting ready for transplant and their siblings or brothers, they can help pack the hospital bag, maybe help pick out toys. So, little things like that, or books, podcasts if they're teenagers, this is a good playlist to have, stuff like that.
Love it. Okay. It says, we did that too. My 3.5-year-old was the patient, and my 1.5-year-old actually takes magnesium gummy together. He had to
Oh,
get lotion a lot for skin stuff after BMT, and my younger son would sit next to him and wait for his lather as well.
that's cute.
Just
I love
feeling
that.
included. They want to be
Yes.
part of it, even the hard. Like we can't hide it from them, because if we hide it from them, they make up other stories like mom chose sister over you and she no longer loves you. Like
Right.
that's way worse.
Yes, absolutely.
So, okay. If you have any questions in regards to siblings that you're experiencing, throw them in the chat. I am gonna roll over to marriage right now. So how can couples strengthen their relationship and communication during this challenging time, especially when faced with the added stress of a child's cancer treatment?
Yeah, this marriage is tough. I remember vividly, we had a patient when I was at Miami Children's, and the couple would bring us food. They were incredible. Unfortunately, they did split up. It does happen, and it's a very big toll that this diagnosis has on a marriage. So making date night or day dates at least twice a month if possible. And I would even encourage, if your child's in remission, wherever you're at in your oncology journey, making that a priority, because you both need time away from appointments, from medications, from antibiotic infusions, from central lines, and to have fun together, to remember why you guys got married, having a family, and just having that time to really reconnect on an emotional level. And like I said, just have fun, whether it's seeing a movie. Like I said, it doesn't even have to be extravagant. You can go for a walk, you can go for a workout, you can go for a cup of coffee, or just sit on the beach, or just cry together, whatever, or go to church together. Maybe you guys haven't gone to church in a long time, and that's something that you guys feel that is going to fill your cup. Other things too is being intimate if possible, as often as you can. That's another way to connect emotionally, that really emotional level, between a husband and wife or spouses. Talking with each other about your fears, really being raw with your spouse, because that person you chose to marry for life, for good, bad, health, sickness. And there really is nothing like growing old with somebody and going through these really hardships with somebody. That's where a marriage really can thrive. It has the opportunity to become so strong. And instead of becoming like this, and you're doing this and I'm doing this, you're really together, and you're able to read each other more. Hey, do you need a break? I need 5 minutes. I just need to go to the bathroom to cry. Okay, no problem. I need to step out for a few minutes. So really having that open communication, as hard as it is, because your mind is going a lot, but just really talking and not bearing feelings or putting it away. Because if we bury those feelings and don't talk about it, it is going to manifest into being angry, being bitter. You will be snappy with yourself. You'll be snappy with your kids. You're not going to sleep. You're not going to want to eat. And you're just going to feel really tense inside. So deal with the emotions together if you need to deal with it separately. But, like I said, respect each other's space too at the same time.
Yeah. For most people during this, I would say it's conquer and divide. So I don't know about anybody on this call. It's usually conquer and divide. And what that means is that it's putting more distance in your relationship and separation.
Right.
You're here, I'm here. You're taking care of this, I'm taking care of that. And I think that in a lot of senses happens, like Erin takes care of the yards and I take care of the house, right?
Yeah.
But now with the cancer kid, like we have other distinguishing roles. And even though for Erin, my husband, like he would come with us, so we were together more often. But even with that, I will tell you that there is a before and after cancer for both Erin and I.
Mhm.
I do believe that we are two totally different people before and after. And being completely honest, unless literally God told me remarry him, we would not be together right now. Like, so we renewed our vows at 10 years. So we're 15 years in now, but it was literally just going, we're different people. Like the way that we think of life,
Yeah.
and where my passion is, where he's driven towards, it's completely different. When you have a child's life in hands, you question life a lot more, and your purpose, and your place in the family. And so for me, it was definitely a lot of prayer. And he's like, remarry him, marry the person he is now.
I love that. That's
Knowing
beautiful.
who he is now, you're going to renew your vows. And that's where we are. So if by chance you're in that spot right now and I'm speaking to you, I just want to say, just pray on that and see if he is someone you would still want to remarry, knowing the things that you know now, knowing your feelings and where you're at now. So,
Wow, that's beautiful. I love that.
I wasn't expecting to talk about that tonight, but
Ah.
hey, there it is.
Well, now that you mentioned prayer, I did want to say, if somebody's part of a church, to find a prayer partner or a good therapist that's recommended. And like you just said, this is going to change your marriage. The question is, how will it change you? how are you going to let it change you for the better or not so much? And realizing that you both have control over that. Don't let this diagnosis steer you and all over. Get a hold of it and don't let it define your marriage. Don't let it define your child. And I don't know, maybe Shannon, if you know, do they have support groups like for married couples for pediatric oncology patients? Does that exist anywhere?
Well, out here it does. I did find a place that
Okay.
actually has counseling and therapy for all families for life. And so Paisley and I are actually seeing one, but they offered it for marriage out here in Tennessee.
Awesome.
So if anyone's in Tennessee and needs that information.
Yeah, and maybe sometimes like you know how you can look up a Facebook group. Maybe there's a Facebook group about, you know, that somebody started.
Yeah.
Yeah. Mm.
I think there's, yeah, not counseling for marriage though. Like there's a Christian Facebook group that
Okay.
started out in Orange County, California,
Mm.
that I was part of when I lived out there. But they're truly amazing in supporting each other. Uh, But
That's
yeah,
awesome.
I would say whether it's Facebook groups or whatever, looking in your area,
Mm.
that would be a good place to start as well. So that was
Definitely.
really the next question is like resources or counseling options that are available for couples. If anybody else has any resources that they know of, type that in the chat. We'd love to see what comes up there.
Mhm.
So,
Yeah.
um, okay, for the cancer kiddos specifically. What techniques can help children undergoing cancer treatment help them to express their feelings and fears in a healthy way? I think we kind of covered this, but let's reiterate it so we can
Yes.
kind of hammer it in because it's a big one.
Yes. They're gonna encourage them to ask questions. You know, we would have a lot of parents when I was at the bedside, we would talk outside of the patient's room, not discuss things, and you only know what goes on in that kid's head. Like, oh my gosh, you know, what's gonna happen and what did they say? And they're already scared as it is already, you know, depending what stage, why they're in the hospital, do they need a bone marrow aspirate? Are they there for a biopsy? So just let them, again, parents feel that lack of control, and so does that child. Like every safe thing that they knew is basically gone and trying to make the hospital that safe space for them. So if you are going to be admitted, bring as much as you can with you, try to bring your own food with you and let them decide that. You know, it is their body, they're going through treatment. Maybe also encourage a journal at the age that they're at, have them write their feelings down if it is hard to express, tending like, you know, upper elementary and middle school is difficult for them to express their feelings. So maybe if they write it down or write a letter,
Or
that
draw
might
a
be an
picture.
outlet, drawing pictures, coloring, um, keeping in contact with their friends too. Because at that point, you know, a lot of times these kids are homeschooled. So they're not there for field day, they're not there for homecoming week. So keeping them in contact with their friends as much as possible, which maybe they can send pictures, they can send a basket, keeping in contact with their teachers so they can still and their school still feel like they're part of what's going on and not feel, oh, I have cancer, I can't do anything. So maybe the teacher can get a bit creative and seeing how that child can participate if they're maybe they can zoom in on, you know, a special day. Like I said, depending on what's going on in that school, and just reminding those kids that this does not define them. This is just a part of their journey. And they will, it's a one day at a time depending to when I was at bedside and we had really sick bone marrow patients, I would tell the parents, we just need to get through the shift and we need to just see what happens because it can get very intense and overwhelming, and acknowledging if they do have any fears to have that expressed to them. again, these kids feel everything. They feel our energy. They feel if we're nervous. They feel if we're anxious. So not dismissing their feelings is very important. Acknowledging their feelings are 100% and keep them moving. So many times too, they muscle waste a lot. They're not getting enough protein, and I've seen it time and time and again. It's hard for them, especially if they're in bone marrow and they're there for a long time. So getting them up and moving, obviously, if they're febrile, if they're having some sort of complication, it's going to be harder. But maybe tell the doctor, hey, we want to get 2-pound dumbbells and just curl or do some shoulder presses. You could even do air squats, but that movement is going to be good for their circulation, their lymphatic system, their mental health, their emotional health. They're still being active. You can even do that with them in the room as well, and trying to keep them on a sort of routine if they are impatient. I know it's hard. I know the kids, sometimes depending on their infusion, or doing vital signs every 15 minutes for the first hour. So, and obviously that is done during the daytime. So if they're stable, sometimes we would say, okay, like we'll push the vital signs back an hour. If we know they've had a very long day, communicate with your nurse, like, hey, instead of 4 a.m., can we do maybe 5 a.m.? It's been a long day, especially if they're little. Sleep, as we know, is incredibly important for recovery, for detoxification, and just getting the body to get ready for the next day. So again, this can all ebb and flow depending on where your child is at, but trying to, again, keep them in a sort of routine can make them feel a bit more safe, since they are out of that safe zone, from their home.
Beautiful, Christina. Thank you. I think you actually hit some points even on my next questions that I had. So, so just go to general.
Bye.
So let's go. Just any other resources, whether it's for families, siblings, couples, dealing with childhood cancer. Is there anything in your area, and parents, depending upon where you're at too, if you could put that in the chat and I'll talk about it, because again, this is recorded and put on YouTube. So we will have people from other states, even Tennessee or San Diego, or that are coming on, or different areas, Wisconsin. So they could be watching this later and wanting to connect in those areas. So
a book that I've been reading just from my own knowledge is, maybe you guys have read it already, I don't know, is this
Dagmara.
Yes. Her book has incredible information, and I know her daughter is currently going through treatment. Yes. So this book, if you guys
I knew it was here somewhere. I'm like, where is it? It's here.
Yeah, I mean, she lays out a lot of really good stuff, like what to pack in the hospital. And as an NTP and as a nurse, please bring your own food to the hospital. We would feed bone marrow patients mac and cheese, cheeseburgers, and all of that is filled with ingredients that we really don't want for the body even now. I try not to eat that stuff just because we're wanting the body to refuel. So don't be afraid to bring your own stuff, because if they can feed these kids that food, there's no reason why you shouldn't be able to. You can speak with your child's physician about that. I know she brings her own food. And again, it's a lot of empowering and educating yourself to feel comfortable to bring all these things, like bring your own body wash, bring your own, shampoo, bring their own pajamas. Because remember, the hospital bed sheets, God knows what they put on them, because they have to disinfect them with all the bodily fluids. So that's and then this book, I've heard it's amazing. I'm reading Dagmara's book, but this, The Metabolic Approach to Cancer, by Dr. Nasha Winters. And then I'm also reading The Cancer Revolution by Dr. Lee Keneally, MD. So understanding cancer, understanding the disease, I think is very helpful to, again, try to wrap our minds around it. And again, pediatric oncology, is a little bit different. But, and again, the more you know, the more comfortable you'll feel, the more at peace you'll have a better peace about your child's care. Asking, and it's intimidating. Okay, you're going to go home with a PICC line and a port, and you're like, what the heck? Ask questions, show, tell the nurses, can you show me what to do? Be confident. God did not do this on purpose. There is a reason for all of this. What it is, I don't have that answer. Maybe in a couple of years we'll find that out. But, this is not in vain. What's happening, and just being that voice for your child, as well, and walking alongside together as a family unit is incredibly important. And the nurses at the bedside, they we see a lot of stuff. We get to know you guys very well. We hurt when you hurt. And also too, I think another important thing is, you guys form friendships with families on the unit. And I've seen it many times where in bone marrow, oh my gosh, this child passed away. I don't want to show my child. And it's like, how do you grieve for your friend's child? And then you're also worrying about your child at the same time. It's just such a complex thing. So if you are going through that, please nurture and take care of yourself, like we explained a lot in this call. And just being there for one another, be a light to somebody. Maybe, maybe they need it. Pray for somebody, or you can ask, hey, can we pray before the transplant? Little things like that, that can help out.
I like that. I was actually just sitting here and I'm like, can Susan Johnson, our founder, write a book, please, and have recipes and all the things in the book? And then, like, because she has time after
Yeah.
just launching the business in San Diego. So, oh, thanks, Em, for putting the link in there. So she put in the link for A Parent's Guide to Childhood Cancer. That's by Dagmara, and she is a cancer parent. Zusa is kind of run out of treatment options at this point, but she has helped her to be where she's at today, and bringing back the quality of life, because sometimes it's not even quantity but quality. So she's been able to manage well through all the horrific treatment and so forth. And so, all right, let's see. I do want to open it to questions, because we're coming up on our hour here and I want to be respectful of everyone's time, but I do want to open it to questions. If you don't feel comfortable unmuting and asking it, which I encourage, because obviously this is where we want to connect. We want to see you, we want to be with you. And I see a lot of black boxes, but you can always type it in there as well. So we always say this is come as you are, that if you are in the hospital bed with your child and your jammies, like, I am totally okay with that right now.
Yes, we don't, nobody cares.
Nope, because been there, done that, and I would have loved the support at that time and just being there. So so if anybody else doesn't have questions, we do just want to wrap up, remind you of even next month. So next month we're going deeper. So it's not just, let me start it with, if you know someone who is in grief through childhood cancer, we have a grief counselor coming on next month. So this is really big for Kick Cancer, because it's something that we haven't addressed yet, and it really is deep. You're more than welcome to attend. As far as grieving what was, cancer treatment changes a lot in our children. Sometimes they're not able to walk anymore, and they're not able to do things. And so We do want to open it up to everybody, but if you know someone specifically that is grieving their child, this is a huge loss, and we are bringing Susan Lotta on from the Austin Hatcher Foundation specifically to address this, and it's a very important topic. So next month for June, and then we'll be taking a break for the summer and coming back with a special month for September, specifically for the kids to come on with our, well, adult kid survivor. So he survived childhood cancer, and he's going to be there to talk to the kids of like, look, I went through it just like you, and I'm here. And so that's going to be a special time for all of our kids to join that conversation. So I'm excited about that. Okay. And then I guess, Christina, just thank you for your time, for your love, for your dedication, and for the bravery of stepping out from what you were doing and saying, look, this is not good enough and I need to go deeper. So thank you for your bravery, for making that U-turn, heading another direction, because we need it so much. So.
Yes, talk about a serious U-turn. But I love it. I wouldn't have it any other way. So
Yeah.
I'll leave my contact if anybody wants to contact me. I'll put it.
Oh, yes, please drop that in there, and let's just say it anyways. I think we said it in the beginning, maybe not. What's your Instagram handle? Type it in there, but say it.
Okay, so I have Christina's _health corner. I post a lot about like Costco hauls, products I love and use. I'm very selective with what I use in my home.
And I've watched a couple of those, and I'm like, yes, I approve. Yes,
Yeah.
I approve. So.
Yes. Then I have Cheers to Health RN is my business page. And I'm going to put my cell number here. If anybody wants to reach out, I do offer free 30-minute calls to discuss health goals, concerns, how I can support you, your family. And then I'll leave my website. But, feel free to text me. I'm not like, oh, please do. I'm a very big, advocate in our community here locally. So.
And where are you out of, Christina?
I'm in Flagler County. I'm in Florida, the Sunshine State. So if anybody's in Flagler County or in Florida, please do not hesitate to reach out to me. And I'm going to put my website here. And then I also have a Facebook page too.
Okay. Thank you for putting that all in. And then we also open this too, just at the very end, if anybody has any questions there it is, Cheers to Health. She's got all the stuff over there. If anybody has any questions in regards to our Kickstart kit, if you haven't received one, please let us know. I'd like to show you or talk to you about what's in there, or if you have any questions, you've received one, you don't know what something is for. We also have our athlete scholarship program for if your child is ready to get back into an activity of their choice or sport, or just, you can apply for that. So if anybody has any questions for our programs, please let us know. Christina, you're amazing.
You guys are awesome. Again, this really was an honor. I did not take this lightly. I know I've seen what you guys go through, and it's a lot. And I just thank you for your time, really.
Yeah, I feel like you're like almost a reflection of Casey Means, like going for the goal, and you're like, I'm gonna go over here. Like,
yeah, like
let's attack.
I don't think I could work. I don't think I could work at the bedside. I'm like, no, this is not. We need to add supplements. We need to, change things. But I'll do what I can do through stuff like this. So thank you for your time, everybody. Appreciate it.
Thank you both. We appreciate you guys. All right, everyone. Take care.
Bye.
Good night. Bye.